Hello, this is Zahirul Alam. Welcome you all on Frankly Speaking. Our guest today is Edward T. Espey, Country Director of PLAN Bangladesh. PLAN is an international humanitarian child-centered developmental organization with no religious, political or government affiliations, which has been working in 66 countries across the globe. With its headquarters is in UK. PLAN works with over 1 million children, their families and communities in 49 developing countries around the world, implementing projects at the grassroots level and national level in health, education, water, sanitation, income generation, and cross-cultural communication. We welcome Edward G. Espey, T. Espey. Mr. Ned Espey, thank you very much for joining us on our discussion today. I was giving some information about the organization PLAN Bangladesh, but we know that your organization is not only based in Bangladesh. You have been working in 66 countries around the globe, and you are virtually and genuinely promoting child rights and end their child poverty this country. How do you find the situation in Bangladesh? First, tell us about that. What are your evaluation about the child poverty or child rights, the level of child rights?
When I first came to Bangladesh, of course, I had heard about poverty, I had heard about population, and on the ride in from the airport, it was not the population, it was not the poverty that struck me. It was the dynamism. It was people working very hard to address their needs.
Do you found lack of dynamism?
No, it was very dynamic.
Okay.
It was incredibly dynamic. Okay. People were working really, really hard, and I thought that was contrary to everything that I had heard. Okay. You know, it's a very poor country.
Oh, you had
all sorts
very
of
negative
problems.
Images. Okay.
And I found something quite different. Much dynamism, people really working hard together to make things happen. There are lots of challenges in Bangladesh. It is now a country of 149 million people, a country with the highest population density in the world. Incredible challenges that the country face, that families face, that children face. But what I have seen, what I have experienced, is that you don't work for children so much as you work with children. And if you do that, a very, very good, quick response. And I think in any country really, but certainly in a country like Bangladesh, you have to support this huge population of young people to have a future. And you don't say, this is what we want you to do, this is what we're going to do for you. You involve them in it. As you talk about education, as you talk about health, as you talk about their rights, you make sure that they are aware of all of these things and what they can do to make it happen, but also the responsibility of the government to support them in making it happen.
Well, supporting the youth to explore or to unfold their potential, that is very critical and very crucial. But how to expand and how to extend that support to the, what are the means, what are the tools of giving them a meaningful support to the youths?
We're really in a very fortunate situation because our main source of funding is through sponsorship. Individuals from around the world support our work with a small donation on a monthly basis. And that allows us to work in a community over a long period of time, 5 years, 6 years, 8 years. And during that period of time, you get to introduce yourself to a community, you get to learn about a community, and work with that community on challenges that they have. And you get to work with that community on solutions for those challenges. And that's what we have done. Going in and sitting down with the community, making sure that as we look at challenges, as we identify solutions, as we implement programs, it is being done with children. It is being done with young people. There is a space there for them. Now, that's what you can do at the local level.
Okay.
But it's really important, too, that you use that experience at the local level. You use those results at the local level to say to other organizations, to other NGOs, national, international NGOs. You use that to say to governments.
Okay.
This works at the local level. Could this be used on a wider basis?
Okay.
Could this be used in other places as it applies to programs to improve health, to improve education? But you also use that to advocate for children's rights,
Okay.
for the obligations that we have as adults to children, to advocate for proper health care, proper education, proper opportunities for the future.
But do you think you're really impressed, or you're really convinced with the level of child rights? I mean, what has been demonstrating right now in our society, or prevailing right now in our society? How much success we have made so far, especially during your tenure? You have spent so far 5 years in Bangladesh. How much success?
I've been here for 5 years, and I'm not satisfied with what has been accomplished globally, as it applies to children's rights.
So it is not mere related to Bangladesh?
No, not at all. I think around the world, from those countries that are recognized as the most wealthy to those countries that have much less resource, there's an awful lot more that needs to be done to support the rights of children, because I have been using well-known examples: education, health, economic security, food security. But it's also very important that a child has a home. Okay. A child is appreciated as a child, you know, the beginning of a future for an individual and for the country and for the world. So there's a lot that we have to do around the world. And yes, there's a lot that has to be done in Bangladesh as a member of the global community. It's very encouraging that this country and most others have recognized what they can do, have recognized the obligations that exist for their populations. Two of probably the most important global agreements that exist to ensure that children are treated properly and guaranteed their rights are the Convention on the Rights of the Children, the UN Convention on the Rights of the Children, and the Millennium Development Goals. Both of these are very specific about what children are entitled to as members of the earth, and particularly in Bangladesh as Bangladeshi citizens. They have very specific rights, very there's specific things that they are entitled to.
But Espey, what I understand that the way you're saying, I understand that you are not pretty happy with the commitment from the parties, I mean the developed world, their approaches and their commitment to the developing countries where the children suffers a lot in many ways. Mm-hmm. So how to broaden, how to make them committed, so that they are really committed, will be committed to stand by the people, stand by the children, and with their resources and other means of helps.
It's not so much a matter of me being happy or unhappy. I think that if I look at what is happening in different parts of Africa, if we look at what's happening in different parts of the United States, if we look at what's happening in Bangladesh, I think we have to be, to some degree, unsatisfied with what we as individuals are doing, what we as organizations are doing, and recognize the fact that we, and that individually, collectively, at the governmental level, et cetera, can and must do a lot more. An example of that we have been working on very much with the leadership of the government of Bangladesh and with involvement through other organizations, UNICEF and others, is working on universal birth registration.
Okay.
The birth registration rate, there was a birth registration law passed, a new law passed for Bangladesh, I think in November 2004. 2 years after that, the machinery was in place to really start birth registration and recording it, issuing birth certificates, maintaining that information for the future, so that the level of registration at that time, which was less than 10%, has increased significantly now, so that you have children, you have the population in the country, still low, but significantly increased, whereby a child will have a name.
Okay.
A child will have an identity.
Okay.
And that means that that person, that young person, has rights as a Bangladeshi.
You are talking about the MDGs, meeting MDGs, and there are a lot of challenges in MDGs. Eradicate extreme poverty and hunger, achieve universal primary education, promote gender equality, empower women, and especially which area you have been working, reduce child mortality and promoting child rights, and other areas is improve maternal health. So there are lofty challenges set in the Millennium Development Goals. What do you think that is Bangladesh heading towards in the right direction in meeting the MDGs?
There continues to be a lot of challenge to meet the Millennium Development Goals. Sometime I support, having a target date for meeting the Millennium Development Goals 2015. I think it's very important, though, that as the country, as the world goes forward with initiatives to meet these goals, that it's not just to say we have achieved a degree of universal health care or a degree of
maternal mortality.
Yes.
Yeah.
You have to
Empowering
have
women.
a system in place that is going to guarantee the sustainability of that. We, along with a number of other organizations, have been involved in initiatives like total sanitation.
Okay.
And it's quite something to see that if you create an opportunity for an entire community to address an issue like sanitation, the sanitary disposal of human waste, it can be done. It's something that is achievable. Now, the successes that we have seen with that have, for the most part, been achieved in rural areas, but there are indications too that by involving a community, including young members in that community, in identifying solutions, working with NGOs, working with the government, bringing the community together so that it is a group looking to find solutions for things like sanitation, it can be done.
It can be done, okay. We know that your organization is UK-based, and you have been doing in a particular area of social services. But as a whole, what's your evaluation that the international community, specifically the non-government organization, foreign non-government organization which is working in Bangladesh right now, collectively, do you think they are really in a meaningful, services, or in a meaningful contributory mood to get over the level of poverty, especially 150 million people here? So the intensity of the effort from the foreign organizations as well as local organizations, do you think these are sufficient really to get over the problems and the grinding poverty?
I can't honestly say that it is sufficient to get over. But again, I look at the global situation. And if again you go to wealthy countries, if you go to poor countries, in none of these countries is government alone capable of addressing all the needs that exist.
It needs a partnership.
There has to be a partnership. It has to be government along with the private sector, the public sector, working together. And the same is here in Bangladesh. The government has huge tasks as it applies to filling the government's mandate of providing basic services to all the people in the country. And it's beyond the government. But with other sectors of the society, very meaningful successes can be realized in health, in education, etc.
Ned, you have traveled around the country, and you saw the condition of our children. On your account, what are the basic miseries of our children, and which areas should be targeted first? To get them out of the clutches of those problems. What are the core areas of problem the children really have been suffering on?
The biggest thing is poverty. Families, communities not having enough resources to provide what it is that children need. But in saying that, it is, as I have had a chance to travel around the country, I have not yet met a child or a family that wants to live in poverty.
Yeah.
They all recognize their responsibility. They work very hard to overcome the challenges that they have. They just need a little bit of support. They need a little bit of help to bring themselves out of poverty. An example is working with families, extremely poor families in the north, that suffer the recurring problem, the recurring indignity of what you refer to as monga here, a period of famine.
Yeah.
Through initiatives at income security, through initiatives at food security, we have seen that a family is not dependent upon government handouts, is not dependent upon NGO handouts. They want to have, interestingly enough, access not so much to credit they want to have access to savings. How can we safely, securely save our money?
Okay.
And this is not 10 or 15 taka a month. This is 1 taka, 50 paish a day. But safely and effectively saving that for monga season, or for illness, or for family events, cultural events that require additional income.
Additional, okay.
I think it's very, Bangladesh is still 70%, 80% rural. It's an agricultural country. And some of the finest businessmen in the world are farmers.
Okay.
They have to be able to read the weather.
Okay.
They have to be able to read different things and make decisions on how to go forward and how to use resources.
Okay. Ned, we are end of our program almost. The last questions very briefly. What are the programs from Plan Bangladesh is going to undertake, very briefly if you say?
We are working in 4 areas: in health, in education, economic and food security, and in rights. Okay. Those are
these are the basic programs.
Those are the basic programs. In education, working at early child care and development, making sure that children are getting, or people are aware of, the importance of
education,
early child care and development, so that the nutrition of a child is met, the need for stimulation in being with other children are met, so that they are prepared for education. Okay. In health, community-led total sanitation, community involvement in health care, using community clinics as a leverage point for delivering resources. Economic security, making sure that people can save money and then have access to credit, and then know how to use it.
Okay. What are you looking at to the future of Bangladesh?
We're all looking at the future of Bangladesh. We're all looking at the future of the world.
Okay. Thank you so much, Espey,
Thank you
for joining us on our show. Dear viewers, Plan Bangladesh, Plan founded over 70 years ago, and Plan is one of the oldest and largest international development agencies in the world. They work in almost 49 developing countries and 66 countries around the world, including Africa, Asia, and the Americas. As Mr. Edward Espey mentioned, that Plan directly supports millions of children and their families, and indirectly supports distressed people who live in the communities that are working with Plan. We hope they will expand their network in Bangladesh and extend their support for the children in Bangladesh and around the world. We thank you very much for watching our program, and we invite you to watch our next episode. Until then, do take care and bye-bye.